Depression is the leading cause of disability, and it is predicted that the incidence of depression will continue to rise. So regardless of what medical specialty you choose, having tools to help your patients self-manage their depression will be important. Major depression is a complex disorder that involves genetic, epigenetic, and environmental factors. This last factor is often stressed because for many people, depression results from accumulation of life stresses. Sustained stress causes sustained cortisol release in the brain. Studies have linked stress-induced cortisol neurotoxicity and depression. Sustained stress affects the brain and can result in a drop in mood. A low mood often leads to a change in behavior. Many depressed patients stop engaging in activities which once brought them a sense of accomplishment or pleasure. A depressed mood is also accompanied by physical symptoms such as a feeling of being keyed up, low energy, or poor concentration, which makes it even harder to engage in usual activities. A low mood is also linked to negative thinking, and negative thinking in turn can cause a low mood. Negative thinking also contributes to people doing less than they usually do. The less they do, the less they feel like doing, the lower their mood, and this can add to their negative thinking. So to recap, thinking, physical symptoms, and behavior are all interacting. This is the vicious cycle of depression, and that it is important to keep in mind when listening to the description of your patient. You will be listening for the thinking that is characteristic of depression. I'm worthless, things are hopeless. Or physical symptoms of being keyed up, having low energy, or not being able to concentrate. And most importantly, behavioral changes. What have they stopped doing? What have they started doing that they didn't before they were depressed? Using this information, you can then draw out the patient's individualized vicious cycle of depression. This becomes the template for which you can then discuss possible treatment interventions such as medication, or a pamphlet or booklet about depression, or a website or an app, or even writing out a prescription for them to make a small step towards resuming an activity that they've stopped doing. Doing this leaves your patient with a number of ideas of what they can do themselves to break out of the vicious cycle of depression.